Hello, I am Taryn Claire from TarynClaireLeNu.com, and I will start initially with my story of diagnosis in the late 2016. I had gone away for a family holiday down south. I live in a hot, sultry place called Townsville, and certainly after having a shower, you drip dry from the bathroom to the bedroom, and there is no need for towel drying your legs. So I went on a holiday, a family holiday down south, which required me to actually towel dry my own legs. So upon sort of bending over and leaning down, I happened to notice that my right breast looked like a tall mountain peak and the left breast a stomped on hillock. I stood up again and everything returned rapidly to normal. I went back down to reassure myself that what I had seen was in fact an anomaly, and my right breast returned to looking like a tall mountain peak and the left breast a stomped on hillock. I wrapped my towel around me and I stomped through to the kitchen. It was morning. My beloved was packing away the breakfast dishes, and I said to him, "Oi, you, follow me." And he thought he was going to get unusually lucky for that time of day. So with a twinkle in his eye and a little prance in his step, he followed me through the bedroom and then into the bathroom, where I ceremoniously dropped my towel. And I did a very elegant swan dive down, far more elegant than previously. And when I returned to stand up again, I saw his ashen face. Now, beloved is a GP, so he has a little bit of information, insight and understanding into what might have been the problem. So we sat down that night and we discussed all possible options of what it might be. One of which was stated as OLUBS, Old Lady Ugly Breast Syndrome. Now, for my beautiful man, what he was trying to do was he was trying to reassure me that perhaps it wasn't as sinister as what he had suspected, being a retracted nipple. And of course, then breast cancer. I've since Googled OLUBS and it does not exist. I returned home to Townsville to do a ultrasound and discovered quite rapidly that in fact it was a breast cancer tumor in the left breast, and that was what was causing the nipple retraction. So fast forward to having a bilateral mastectomy and an axillary dissection, and part of the issue is that the type of breast cancer that it turned out to be is one that lacks E-cadherin, which is the glue that holds the cancer cells together. So instead of forming a lump, it spreads like a spider's web. And as you can imagine, spiders' webs are very difficult to pick up on a mammogram. And so, you know, they are best found through MRI. And, you know, my initial diagnosis of 14 millimeters was actually diagnosed as 3.5 centimeters with friends under MRI. And when I had a bilateral mastectomy, it was actually 5.5 centimeters and friends, and discovered that it had spread to the lymph nodes. Now, having lymph nodes involved, I had an axillary dissection, which meant I had about 13 lymph nodes out of the supposed 40 taken out. And at the time when I was discussing it with the surgeon, it was very briefly mentioned, oh, well, you might develop lymphedema. There was a pause, and then we moved on to other things. So clearly it was really important that I had lymph nodes taken out, because, you know, breast cancer can be a metastatic disease. But you know, as it turned out, I then did chemotherapy for 12 weeks. And at the end of chemotherapy, I was due to start radiation. So 3 weeks after chemo, just before I'm due to start radiation, it is in fact Good Friday Eve. And on Good Friday Eve, I'm sitting at the dining room and I look down at my thumb, my beloved sitting beside me, and I complain to him that I think that I've had an insect sting me on my thumb. And, you know, it's swollen, it's painful and irritated. And he takes a look at it and says, "Oh, I think that's actually lymphedema. So the horrifying aspect about that was that I was actually going to spend the next 4 days, thanks to, you know, public holidays all throughout the year. We have, you know, that never that many public holidays all in a row. And I did not have access to an off-the-shelf compression garment for those 4 days. The pain was fairly significant. The swelling actually increased over that period of time. I got some mild relief by bandaging myself in just a crepe bandage, but certainly that didn't provide anything to stop it from getting worse over those 4 days. I returned to the hospital on the Tuesday because I was seeing the specialist on that Tuesday morning, and happened to manage to get in to see the physio beforehand, who diagnosed me with lymphedema and put me in an off-the-shelf compression garment. Went and saw the specialist afterwards, the oncologist, and I was rather distressed. And it was surprising to me at that point in time that, you know, I started sort of making the conversation that I was very concerned about doing going ahead and doing any radiation therapy if this was in fact lymphedema. Now, the oncologist's position, of course, is that they're wanting the best outcomes for their patients. And so, you know, anything towards thinking that this might not go ahead was not really openly welcomed at the time. So I was surprised also the lack of real empathy and compassion, because at that point what people are really focused on is survival, and that is all that they're wanting to do, is to make sure that you survive your condition. But so lymphedema is just a side effect. Now, 1 in 7 women are being diagnosed with breast cancer every year under the age of 85 within Australia. And from those ladies who are having lymph nodes out, 1 in 5 goes on to develop lymphedema. So once you have lymph nodes out, you are considered as having an impaired lymphatic system. So, you know, at that point, you need to start doing things to look after yourself and put some proactive care in place. So fast forward, I went from off-the-shelf sleeves to, you know, trying to do some cold laser, to do decongestive therapy with bandages. And it was very rapidly not getting any better, not improving, and became very rapidly clear to all of us that I would need custom-made sleeves. So the compression on off the shelf was not enough, and I needed to have something that was going to hold me firm. For someone who was freshly and newly diagnosed, I found it incredibly difficult to cope and manage with that new diagnosis. And, you know, on top of it, be met with the idea that, you know, I was having difficulty with the lymph nodes that I had. They were being pretty lazy and they weren't really working. So the way I sort of saw it is that, you know, I had 13 lymph nodes taken out, and I actually had some lymph nodes left in my armpit. But what had happened is, in fact, perhaps they had taken the 13 lymph nodes that were the actual workers. No offense to people who are council workers, but it's very often I can see when I'm, you know, in the middle of roadworks, might be a gang of workers sitting beside the road with not a lot of work being done. And it kind of feels like that with my lymph nodes in my armpit, that it was actually just the 13 workers that were removed, and the rest are all the council workers just sitting on their tea break having a lunch and not actually doing very much. So it really rapidly became clear that I was having to put in some strategies, not only coping with it physically, but I needed to put some strategies in place to cope with it mentally and emotionally. And one of the first things that I did decide was that I was not going to go down the track of doing radiation, partly because if I had lymph nodes removed from my arm, I would actually need some of those lymph nodes. Really, I'm going to need the ones that are in the clavicle area and here on the chest to kind of compensate for the work that the other ones in the armpits weren't doing. So it was fairly traumatic to actually have to come to that decision, because not only do you make the decision for yourself and you are basing it on the fact of self-awareness, knowing who you are and how you know you will cope in the future. Because for me, I understood right there in that moment that it was not going to be about quantity of life. I wanted quality of life. And if I couldn't cope very well right then at the very initial diagnosis in the very early stages with the lymphedema, I could not begin to imagine that if I had done radiation, how much worse the lymphedema was going to be, and whether I had the capacity to manage and cope with that emotionally at all. So from that perspective, you know, I then made that decision, and I kind of ghosted the oncology department or the radiation department. I'd already had all the models done, all the computerized models, all the measurements done, and in fact the tattoos to go ahead and start the radiation process. And I just started ignoring all the phone calls from the hospitals, because it was that next step of, and of course, eventually that caught up with me, and I needed to go in and speak with the radiation oncologist. And fortunately for me, I had the most wonderful man who kind of explained that the hospital system is geared as a system, and they have protocols that they need to follow. And they often fail patients sometimes when they don't take into consideration the personal account of what that person is going through. So we spent a long time discussing, you know, the drawbacks of not doing radiation, but of course the drawbacks of if I were to do radiation and the effects of it on my lymphedema. It was one of the most fortunate conversations I had, because even though we are sitting in a system, we're still waiting to be given permission on some level that someone above is actually going to give us the okay not to do what is considered to be right and part of the protocols. And I walked away from that appointment feeling such overwhelming relief and gratitude that I had actually met with a professional who not only was able to hold space for me, but was able to walk through the pros and cons and to reassure me that in fact it was my ultimate decision. And if I was going to struggle living with further incapacitation in terms of the lymphedema, that I needed to do what was right for me. The bonus part of it was that his wife, in fact, had the exact same type of breast cancer that I did, which was unusual for my age group. Is certainly far more common amongst older women who have done hormone replacement therapy. So my diagnosis date and age was 41. So that led me on the road. That was Easter of 2017. And what I noticed from there was that, of course, during the winter months, it was easier to manage the lymphedema. However, by the time summer rolled by in a hot place like Townsville, the increasing heat and combined with the hormonal changes within the body and the hot flushes, it really did make the lymphedema symptoms, pain management, really difficult to manage, and the arm became increasingly bigger. And my experience with it was certainly one that I found quite harrowing. So it took a while for the surgeon to suggest, actually it didn't take a while for her to suggest, she suggested that I had a breast reconstruction, and I was actually dead against the reconstruction For me, I had had enough of doctors and surgeons and oncologists and specialists telling me what to do, how to do it. I have doctor phobias and having needles poked in you. The idea of actually you can't do reconstruction here in Townsville, that I would have to travel and spend time away, really was not very appealing, considering I didn't have any family down there. But her suggestion was that there was a very minimal percentage of people who actually do find benefit from doing reconstruction. She said it was in the 0.02%, and I was willing to take the risk. And so I journeyed down to the surgeon's office to apply for my reconstruction. And when I mentioned I was doing it because I had lymphedema, we had a very strong no from him. He said, you are to do this only if you are wanting to have your reconstruction. So I went away and changed tack, and then told him, well, actually, I do want the reconstruction for the purpose of reconstruction. What I would like to say is that when I went down in that February, whether it was a result of actually for the first time since the previous April, when it was Easter, going down for that surgery, the combination of having some painkillers and some sleeping tablets, it was the first time I actually got to sleep through the night since diagnosis. I found it really, really difficult to sleep with my lymphedema arm. My lymphedema was profoundly different at night. In fact, it was much worse at night than during the day. And the pain, the discomfort, in fact, I could feel the limb slowly filling up. If that makes sense to anyone who has lymphedema, please connect in with me, because this is something which therapists don't seem to agree on, but certainly in the still of the night, it felt like a really slow trickle of water inside a glass dome, as if it were in a conservatory, and that really slow, painful trickling of water. The aggregated accumulation of that was incredibly difficult to sleep with. I found that I could only sleep on my right side with the left arm elevated. If you fell asleep and rolled over and slept on the left side, it meant that the arm was significantly more swollen the following day. So I really did not sleep very well for that period of time. And when it came to the reconstruction, it was the first time that I really had a break from irregular sleeping patterns, having very little deep sleep, restorative sleep, healing sleep. And I found a significant improvement in my capacity to cope. And I spent 3 weeks in hospital because the lymphedema meant that the drains took much longer to come down in numbers. But I remember remarking to people how significantly improved the lymphedema management was after that period of time in hospital. The first operation, of course, was just an expanders, and then had to go down 4 months later to take the expanders out and to put in the prosthesis. And of course, you know, the lymphedema felt like it was much more manageable. And they cleared away a lot of the scarring in the underarm, in the armpit. And of course, you know, wearing the compression bra that they give you helps significantly, because while, you know, the arm is the one that's been measured and, you know, I have diagnosed as lymphedema, I have in fact got the experience of lymphedema on that left side down, you know, what I call my camel bags, which are my back breasts, and the left side is significantly larger under the arm, and of course what I call my foobs now, my fake boobs. The left foob, if I am lying down on my back, you can see that there is a difference, despite the fact that 2 prostheses of exactly the same volumes were put in. So that there was improvement in my state up until, of course, summertime rolled round, and with the heat, and Townsville's got a significant amount of, it's very, very hot, the arm started to get bigger again. So, which led me to finally going down to Sydney to do some ICG, which is indocyanine green. And what that means is that you see a restorative plastic surgeon, and he's a specialist in Australia, Dr. Hiru, and a phenomenal, beautiful, wonderful, kind, loving gentleman from Japan who basically injects indocyanine green dye into the webbing between two lots of webbing and into your wrist, and with a special light in a darkened room tracks and watches your lymphatic system deal with this dye, this fluorescing dye. And from that, it's established very clearly, quite quickly and rapidly, that this dye had nowhere to go. So if you imagine most of us in our bodies who have a lymphatic system that is really working and working well, you imagine that there is a highway. So on my ordinary normal arm, that dye would have been taken up, the uptake would have been rapid, and would have been transported very quickly out of my hand all the way up my arm and through my circulatory system. And whereas in the impaired arm, it pools. The highway is broken. In fact, there are no back roads. There are no dirt tracks either. It just sits and pooled. What we also got to realize and understand is that I am abnormally wired. So instead of everything going from my hand up my arm, it actually moves from my wrist up through my palm, over my webbing, and then through the top of my hand. So this gave us a very clear understanding that all the manual lymphatic drainage massages that I was doing, spending $95 a week with a physiotherapist, doing that really light feather touch for 2.5 years prior to that, had been absolutely useless, because what we got to discover is that the pattern or the map of which it was moving was different to the pattern and map that we had been using for those 2.5 years prior. We also got to discover that that very light touch was not working. In fact, we had to go really deep and really slow in order to move the really thick, gluggy lymphatic fluid out of the lower limb. Also got to discover that I am in fact lucky that while I don't have lymph nodes that are working in my arm, that I am wired that for the lymphatic pathway to actually go the front of my shoulder and actually dump into one of the nodes in my clavicle. So that changed the mapping of how I now do my sequencing. It also changed the way in which I was using my compression pump. Now, you know, using garments that are custom fitted, I also use a lymphatic pump, and you know, without that pump, I find that it's very difficult to manage the pain. At least this kind of squeezes it, and I used a much slower sequencing, and in fact I went a little bit harder on the pressure, or higher on the pressure for the lower limb, where it's become quite fibrotic. During that time, I also got to see 2 other plastic surgeons and spoke about lymph node transfers, as well as venous transfer, where they can basically stitch you up to a different, hopefully working vein, as well as talking about liposuction. In order to qualify for liposuction, you need to have over 20% of fat cells in your arm. So your skin cells are actually programmed to turn excess lymphatic fluid that is sitting in that system for an extended period of time into lymphatic fat. Now, the difference between lymphatic fat cells and normal fat cells is if you diet with a normal fat cell, you can shrink that fat. With lymphatic fat cells, it is there, and the only way in order to reduce it, to my understanding and knowledge through these appointments with the reconstructive surgeons, is through liposuction. So, you know, there is, of course, different risks involved with each one, and different cost prices, and also different success rates. So at this point in time, because I only sat at 21% fat, and in Townsville it's so hot, I have decided that the liposuction would not be worth it, because I would then be compelled to use the lymphedema sleeves 24/7. And in Townsville, you know, you find else it just goes back, the fluid just leaks back into the arm. You know, in Townsville, you know, I suffer from a little bit of eczema from wearing the compression sleeves, and so I do need to take a break from time to time. So that was kind of off the list. The lymph node transfer was kind of off the list, and the venous exchange was going to be sitting at a 50% success rate, and the cost was in the tens of thousands of dollars. So for this stage, we're just sitting, and hopefully technology is going to improve along the way. But in the meantime, I have used a lot of other therapies in order to cope and manage. So I have tried colonics. And, you know, if you think of your lymphatic system, it's your sewage system. And if your downpipe is blocked, the rest of the lymphatic system isn't going to work very well. So I've tried that. And none of my things that I've tried have been the 100% perfect rate, but everything I have found has been in conjunction with a lot of other things, has provided me with some relief. So, you know, I do say to people that there are things out there that when your therapist is going to say to you, well, this is the way you need to do it. From my understanding, speaking with the Macquarie team, the lymphatic department down there, is that anything for it to become into practice with a therapist takes about 10 years for them to actually research it, to test it out before they're going to say it doesn't damage your lymphatic system, and they can tell everyone with lymphedema to do it. I don't have 10 years of patience within me, and I'm certainly going to, I do take my experimental role quite seriously, and there isn't anything, I guess, that I wouldn't want to give a try. And I do go and try anything I hear about. So I have tried different supplements. I have tried homeopathic drops, and I use a negative pressure device on my arm, which has been an absolute godsend. It's a home device, and it has rollers as well. So it rolls the arm, and it sucks it at the same time, which I feel is like giving the arm its own little exercise regime and making sure that everything still maintains its flexibility and movement. I have tried doing all sorts of things along the side of, like I said, drops, natural therapies, using enzymes, tried keto programs, and as I said, you know, there is nothing I won't try. And certainly at home, my lounge room looks like it's some kind of unusual medical ground. I sit there and I keep notes about my limb size. I have 2 little beauty spots on my arm. So I measure before I do something, and then I measure afterwards. The most success that I have had of late, that I feel compelled to tell people about, is a little device that uses a microcurrent. Now, initially, when I first had lymphedema, I was using one of those Revitive machines on my feet because I needed to increase circulation. Certainly during chemotherapy, I had major issues with my circulation. And, you know, you fill up with fluid, and with an impaired lymphatic system and having a buildup of fluid within the body, in fact, around my bald head, I could stick my fingers in and it would sink in something like 0.5 centimeter. And that is how much fluid was sitting around my head. You know, when you complain to the oncologist or to the oncology nurses about that increased fluid around the body, you know, they just sort of shrug their shoulders and just sort of say, well, you know, that's a side effect of chemotherapy. What I didn't appreciate at the time is that it was putting my lymphatic system under huge stress. So I was using after, sort of sitting there during chemo, I started using this Revitive machine to increase the circulation in my feet. And when the lymphedema came along, I started to put my hands on the machine as well, which would kind of be like almost like a giant TENS machine, putting an electrical current through the arm and providing some form of pain relief along the way. This new little device that I'm using is actually a microcurrent. The curiosity is that while I've got it around both wrists, I can't really feel it in the lymphedema arm at all. There is a significant amount of bioimpedance. When I run the cycle through the first time, I feel nothing. By the third time in a day, or on the fourth time in a day, rather, I'm starting to feel a little bit more of that current through the arm. So certainly that is very exciting. I often will measure before I use the current and after I've used the current, and I can reduce the limb size by about 0.5 centimetre in one session. So while therapists sort of might say, and I've come across this regularly because it happens with the negative pressure device as well, that they'll say, yes, but it won't hold. And, that's all the therapist is interested in, is that, you might be able to reduce that amount, but then you can't hold it at that level. Now, I would say to people, if you are a therapist, can you please sit in the seat of compassion for a little moment? If you have an arm or a limb that is filled with fluid, it's incredibly uncomfortable. It's, like you've rolled your ankle and your ankle is filled with fluid and all that fluid is sitting in the joint. It is painful and there's a lot of discomfort and difficulty to use that joint. So if you are reducing a limb circumference by 0.5 centimetre, even for a few hours or even for half a day or whatever it's going to do, you are actually giving that patient and providing that patient with significant relief, pain relief, from not having as much fluid in the area. Mentally, that goes a long way. And, we must stop, just saying, well, if it doesn't hold forever, then don't use that device. I say from a patient's perspective, I find it very difficult to get the correct amount of pain relief. This little medical device is FDA registered in Europe under a class 2 medical device under the TENS machine category, and I love my device and happy to let people to message me afterwards if they want to know more information about it, as well as the negative pressure device that I use. Both of them are fairly expensive. I'm still yet to purchase myself a laser, and that is next on my list because there's a lot of evidence to suggest that's going to help. I have used it with my physiotherapist, but it is best used regularly, like every day, and at $95 a pop to go to the physiotherapist. I think that, I might be able to save up and get my own at some point. Not saying that they're not worth it, but certainly this year when I went back to the physiotherapist, they had put the price up to $120 a session, a $30 hike, apparently to keep in touch with what people are charging down south, has meant that those weekly visits have dropped off. So I'm wondering now which bits I have forgotten to speak about and which bits I have forgotten to tell you about. But I have, also done what is called rebounding. And instead of using a little mini trampoline from Big W or Kmart, I have researched to find the lymphosizer, which is handmade in New Zealand. And a lot of research has been done actually by the Auckland University, and it goes into the working alongside a metallurgist, going right down to the types of metal that are used will change how it affects your body, how the springs are sprung for the northern and southern hemisphere, whether it's going to crash your biomagnetic field or not. And certainly the cheaper trampolines that have not taken into account how it is made certainly do crash your biomagnetic field. So having touched on all those little aspects and elements, I am, finding that, in combination with making sure that, the suggestions are that we use our compression during daytime use, I am finding that I cannot miss a nighttime use. The way the Queensland works with the government, we are covered through our local hospital for 2 garments a year, but they are day garments and not nighttime garments. My management significantly improved when I forked out of my own private funding for a nighttime garment, and it's really, really super comfy. So I swapped between a nighttime garment, which I still use my glove under because my fingers were having a few issues, and I swapped that out also with a Mobiderm off-the-shelf sleeve, which helps break down the fibrotic tissue. This year, I had also discovered an amazing practitioner. She's actually a naturopath down in Brisbane, and getting on board with her, she has been a phenomenal support in terms of understanding a few little extra elements, using creams with oils that support the lymphatic system, increasing the lymphatic support for a lot of women as a form of proactive care for their bodies. So, I do believe that proactive care during chemotherapy would be key for people because your system is under a lot of stress and pressure. So when I've been doing bandaging, what I have noticed is that I become increasingly really, really unwell during bandaging. And speaking to Chelsea, the naturopath who has a passion for lymphatic systems, she gave me the best advice ever, is that, when you are doing your bandaging, you're actually squeezing all these toxins out of your arm, and you're basically being unleashed on the entire body and the entire lymphatic system. And it really puts the entire body into distress. And, after the bandaging up at the hospital, which depending if you're doing traditional bandaging, you'll be up there every day, and or Coban is twice or 3 times a week. And so, by the time I'd got a new bandage on, I'd get to the car and I'd feel significantly unwell and think to myself, I should have actually got someone to drive me home. It's a 25-minute trip home, and I would be concerned that driving, feeling that unwell, wasn't really a great idea. Chelsea reminded me that, to decrease the lymphatic load would mean actually moving towards eating foods that were really light. So, now, switching out to soups and broths where the body isn't focusing on digestion has made a significant improvement. And I am really grateful to Chelsea for adding another layer of insight into a system that, is starting to be recognized, that we all need to learn a little bit more about it. So with saying that, I am now 3.5 years down the track. This is the first time that I'm really speaking about the lymphedema section. I've spoken ad nauseum about breast cancer. I talk about the fact that I will say the truth and the whole truth. And it's taken me a long time to come around to this point where I can actually speak about my lymphedema without crying about it. And I often say that when you can speak about something without crying, you're on the path to being healed. It has taken a very long time, and there have been some incredibly dark days. Every morning waking up and having to make that conscious decision and that choosing that today I'm choosing to focus on the things that I can do something about, choosing to focus my thoughts on the good things, because it is incredibly unraveling. And certainly at one stage I was really feeling a little bit flat and depressed about it, because as you start to go into it a little bit more, you begin to notice that you are lymphedema, your lymphatic system is not just my arm that has been diagnosed with lymphedema. They say it doesn't spread, and yet here I am finding that, you know, like when I just used to use the arm sleeve without the abdomen section, you know, I would wake up the next morning and my whole left side of my face had actually swollen. And that had, I guess, something to do with not maybe I hadn't cleared sufficiently beforehand or activated enough. And which reminds me, I need to tell you a little bit about the breathing aspect of it. But certainly when I think about